to help the audience understand this, because I'm sure because it's a really critical piece that you mentioned that it's very unfortunate what happened to Steven's mother, and that's just really really sad story. So a lot of the audience, say the billions of people that are watching that are not familiar with the Canadian health system, you just assume, okay, I told this doctor the set of facts about myself or the nurse. How come it doesn't go to the next care team? Like that just seems ridiculous. Like, why is that the case? Maybe you can expand upon what's causing some of those critical not miscommunication, but these gaps.
Absolutely. It's really a function of how health information exists. So we all understand an Excel spreadsheet, data in very clean rows and columns. Anybody who interfaces with any type of system understands the idea of drop down boxes. Now, the reality is, our electronic health record, the majority of the information, over 80% of that, is in unstructured clinical text. It's the clinician notes that they document or their transcriptions. When you're sharing with them those critical, important pieces of information that they use one on one to determine how do they provide care, how you're feeling, your patient, your family history, past procedures that you've done. On top of that, you have all of the correspondence between the various people on your care team. And that can include everything from a letter from a primary care physician to a specialist, to different service units in the hospital sharing their transcription, their diagnostic reports about a particular patient. So what you end up having is, for a single patient record, you could have hundreds and hundreds of pages of material that we expect our clinicians to read through to get up to speed, or as up to speed as they possibly can, around a particular care pathway. Or if you say, okay, is this patient a candidate for clinical trials? What is inclusion exclusion criteria in terms of, we want to generate real world evidence? I want to know patients with this demographics, these comorbidities, who took medications at this line of therapy. That does not exist in the drop down boxes of any electronic health record, including Cerner, including Epic, anywhere in the world. So think of a skyscraper's worth of data that somebody has to go through in order to generate these data sets, understand best practices, make evidence-based decisions. And again, going back, clinicians don't have the time. And that's where, applications of AI can have huge, huge impact.